I believe everybody is aware of the clinical state's progression as first put forward by Scher and Heller probably about 10-15 years ago. And there's no question that the evolution of prostate cancer as it goes from one clinical state to the next is a very dynamic process. Very often these states go very quickly. So somebody is newly diagnosed, they have primary therapy. From primary therapy they have a PSA recurrence, they may or may not get hormones and or radiation. Then they develop progressive disease, get other hormones, become resistant, and then we have patients who have gone through a variety of different hormonal therapies in addition to chemotherapies. What happens is that very often we're missing one clinical state. We're watching people go from localized to metastatic, but we're missing that one little area which is M0, for which apalutamide has been newly approved based on two very large clinical trials. What's fascinating is that we as medical oncologists, and probably less likely for urologists and radiation oncologists, often don't see it happen. We don't catch the patient as the patient's disease is strictly castration resistant, meaning that they just have rising PSAs in the absence of disease. They seem to go one moment from just being resistant to being metastatic within a very short period of time. Sometimes it's a matter of weeks. So finding those patients who have this transition has been very, very challenging. I think it's very appropriate to use apalutamide for this group of patients, but the problem is patients hate to have scans done very frequently, and really trying to get them at that time point is going to be a challenge that we're facing. Perhaps the use of next-generation PET imaging may facilitate earlier identification, such that relying on good old-fashioned bone and CAT scans may fall out of favor, and we may have these more sensitive assays or imaging studies by which we can pick this up sooner and exclude these people from those therapies and get them on other therapies. So I'm hoping that we'll be able to get these people treated much sooner with earlier identification.